Mom, are you all right? Why do you look moody again?
I'm fine, Amy. Just a little tired.
You don't seem fine, Mom. Is it because your legs are a bit swollen and you're finding it difficult to walk properly?
Yes, Amy. And on top of that, I've been having trouble sleeping at night. Maybe it's because of the coffee I usually drink.
No, Mom. If it was just the coffee, why are your legs swollen? I think I know what's wrong with you, Mom.
Really? What do you think is wrong with me?
Well, I think you might have diabetes.
What? Why would you think that?
Mom, the symptoms I've seen you experience at night and your lifestyle habits suggest you might be at risk for diabetes. Lack of exercise, a high-carb diet, and constant stress are all factors. I know you might have been ignoring these signs, but it's important to take them seriously and see a doctor.
Is diabetes life-threatening?
Yes, Mom, it is. Diabetes can cause serious health issues like heart and nerve damage, and even kidney failure. I don't want you to face any of these complications, so that's why I'm so concerned about your health.
Thanks for your concern, Amy. So, what are those nighttime symptoms of diabetes you mentioned?
I'm glad you asked, Mom, because I'll be sharing 7 nighttime signs of diabetes you should never ignore, from blurry vision to sleep apnea. These symptoms can be life-threatening and need immediate attention.
Really? Please tell me.
I'll also explain how to recognize these symptoms, so listen closely until the end to understand how to easily detect them and fight diabetes for good.
Okay, I'm all ears. What's the first sign?
Blurry vision, which is sometimes accompanied by frequent headaches. Blurry vision is usually worse at nighttime because the eyes have to work harder to adjust to the lower light levels. This can cause eye strain and headaches.
But how's diabetes related to blurry vision when it's caused by high blood sugar?
Blurry vision is most noticeable at night and is often caused by diabetic retinopathy, where high blood sugar damages the retina's blood vessels. These damaged vessels can leak fluid and blood, leading to blurred vision. In severe cases, it can cause cataracts, glaucoma, and blindness.
Interesting. Does this condition last forever?
No, it doesn't always last. Sometimes blurred vision can be resolved when blood sugar levels are regulated, but in severe cases, glasses may be necessary.
So, can blurry vision alone confirm if someone has diabetes?
No, Mom. There are more symptoms. Excessive thirst and frequent urination are also indicators of diabetes.
Really? Are you sure?
Yes, Mom. Excessive thirst and frequent urination are often pronounced at night because blood sugar levels can increase in the evening due to the body's natural cycles. As blood sugar rises, the kidneys filter out the extra sugar by producing more urine. This increased urination at night causes dehydration, triggering thirst. The cycle continues, resulting in even more frequent urination and thirst.
No wonder. I've been experiencing frequent urination lately. I thought it was because I drank too much coffee before bed.
I noticed that too. That's why I suggest you try reducing your fluid intake in the evening and avoiding caffeinated drinks after dinner. If you still urinate frequently at night after this change, it may be a sign of diabetes.
Oh, then I'll give it a try to be sure. Thanks for the advice.
You're welcome, Mom. Next on my list are muscle cramps, tingling, and numbness in the hands or feet.
I'm familiar with these signs.
Exactly, Mom. Muscle cramps, tingling, and numbness in the hands or feet are caused by peripheral neuropathy, a common type of diabetic neuropathy. Peripheral neuropathy worsens at night because the body's core temperature drops slightly, which can elevate its symptoms.
Wait a minute. What is peripheral neuropathy? Or what do you call it?
Peripheral neuropathy is damage to the nerves, responsible for transmitting signals from the hands or feet to the brain. This damage can result from high blood sugar levels, leading to muscle cramps, tingling, and numbness in the hands or feet.
Oh, I get it. But does this peripheral neuropathy come with pain?
Some people with peripheral neuropathy may also feel pain in their hands and feet, typically more severe at night. The pain can be described as burning, tingling, or aching, and it can be uncomfortable.
Since I haven't felt any pain yet, the tingling and numbness I've been experiencing might not be due to diabetes, right?
Well, I can't say for sure since you've often mentioned tingling and numbness in your hands. They're all part of the signs.
Oh,
don't worry, Mom.
Okay, dear.
Mom, you've often mentioned having trouble sleeping. Do you think you might have sleep apnea? It's another nighttime sign of diabetes.
What's sleep apnea?
It's a condition that causes interrupted breathing during sleep. This can result from various factors, but the most common cause is excess weight around the neck and throat, which can compress the airway, making breathing difficult. In people with diabetes, this can worsen due to the body's tendency to retain fluid, leading to swelling around the neck and throat.
Wow, that's serious. Are there any other diabetes symptoms that can affect sleep quality?
Yes, there is. It's called nighttime hypoglycemia.
Isn't nighttime hypoglycemia caused by low blood sugar levels? So, what relationship does it have with diabetes?
Well, people with diabetes who exercise close to bedtime or are physically active during the day can experience nighttime hypoglycemia. This happens because exercise can lower glucose levels for up to 24 hours afterwards. Also, taking too much insulin or drinking alcohol before bed can drop blood sugar levels, leading to nighttime hypoglycemia.
Interesting. So, what are the symptoms of nighttime hypoglycemia?
The symptoms can vary, but commonly include waking up hungry, headaches, sweating, weakness, and difficulty falling back asleep. It can also lead to daytime sleepiness, fatigue, and trouble concentrating. Constant weakness or fatigue can also be caused by insulin resistance, where cells don't respond well to insulin, leading to high blood sugar levels. This can result in ongoing fatigue, especially at night, when the body is weakest.
I guess that explains why I've been feeling weak even at night.
Sorry, Mom. That's why I suggest you visit the hospital.
I know, but I'm interested in hearing more about diabetes from you.
Okay, Mom. Did you know diabetes can cause extreme hunger and unexplained weight loss at the same time?
How is that even possible? If someone is always hungry, wouldn't they eat more and gain weight instead?
For normal people without diabetes, yes. However, for people with diabetes, extreme hunger is often caused by an imbalance of glucose and insulin levels in the body. When there isn't enough insulin to regulate glucose, the body signals the brain to eat more to balance out the excess glucose. This extreme hunger is especially noticeable at night when the body is trying to rest and repair itself.
Ah, I see. What about the unexplained weight loss?
It happens because the body can't properly use glucose from food. At night, the body releases a hormone called glucagon, which breaks down fat cells into sugar for energy. This can result in a loss of lean muscle mass as the body uses muscle tissue for energy instead of fat.
With all these alarming symptoms you've told me, I think I'm starting to feel scared.
You don't have to be scared, Mom. You just need to go to the hospital and get treated. The earlier, the better, so you don't experience advanced and painful symptoms. So, are you ready to go to the hospital now?
Yes, I am. Absolutely. Completely. Totally. Let's get going. ASAP.